Hello everyone, my name is Marie Delmis. Welcome to my channel, A Wealth of Good Health. Today I am going to talk about schizophrenia disorder. Keep in mind, this is a segment of schizophrenia spectrum and other psychotic disorders. Before we start to talk about schizophrenia disorder, subscribe to view more videos in English, French, and Creole. Every Sunday, new video will be uploaded, so check them out. If you, a family member or friend, is struggling with this condition, please email Marie Delmis. Few questions will be selected and discussed in the Ask Marie session. So ask away. So, what is it? Schizophrenia is a serious mental disorder in which people interpret reality abnormally. Someone with this disorder may experience hallucination, delusion, disorganized thinking, and speech. Well, how to diagnose someone with schizophrenia? According to the DSM-5 updated version, 2 diagnostic criteria have to be met in order to be diagnosed with schizophrenia. First, having at least 2 or more of the following symptoms for at least 1 month, and at least one of the symptoms must be 1, 2, or 3. So what are the symptoms? Remember, one of them has to be 1, 2, or 3. Here we go. Symptoms like delusion, which is the first one. Hallucination is the second one. Disorganized speech is the third one. Grossly disorganized or catatonic behavior is another one. Negative symptom, which is diminished emotional expression, it's another type of symptom. Also, significant impact on social or occupational functioning for at least 6 months. Has social or work dysfunction, interpersonal relationship or self-care dysfunction or impairment. And a second symptom could be the negative as I talk about it. Well, the symptoms can be remembered by using the acronym DHAND. D for delusion, H for hallucination, A for abnormal behavior or catatonic, and for negative symptoms, which is like flat affect or lack of speech, and disorganized speech is the last one. Symptoms can be characterized in 3 groups: positive, negative, and cognitive. Positive symptoms are like psychotic symptoms such as delusion, meaning false belief. Patient believe people from radio or TV are talking to them or about them. Hallucination are sensations that aren't real, auditory, common, etc. Disorganized speech are word salad, and disorganized behavior are bizarre, like overdressed with multiple layers, even during summertime. Catatonic behavior refers to movement or posture, like sitting in a certain way for a long period of time without moving. The negative symptoms are behaviors, emotion, or thought process that are absent, such as flat affect, or inappropriate response, alogia, lack of speech content, etc., avolition, which is decreased motivation to achieve certain goals, cognition symptoms, not being able to remember things or learn new things, etc. Might be just a little bit difficult to notice. Cognitive symptom is not needed in order to diagnose someone with schizophrenia. People with schizophrenia cycle through 3 different phases. Prodromal phase, which is client might become withdrawn, look like someone who's depressed or have anxiety disorder. Active phase, it's like severe symptoms like the positive ones, for instance, delusion or hallucination, etc. The third one is the residual phase, not being able to concentrate. Positive symptoms respond well usually to medication. What are the causes for schizophrenia? Research proposed a combination of genetic and environmental factors contribute to the cause. Well, the different factors include genetic, which has to do with too much dopamine in the neural synapse, as well as family history. Environmental factors linking to schizophrenia consist of drug use, prenatal stressors, and stressful or emotional life events as well. The different treatment include antipsychotic medication, along with counseling, job training, and social rehabilitation. Well, the medication, which is antipsychotic, which is a class of medication which blocks dopamine receptors. Psychoeducation is really important for family and patients, educating them about the disorder. Cognitive behavior therapy, or CBT, is used to reduce or eliminate psychotic symptoms. Social skills training, teaching the basic of social interactions, and both verbal and nonverbal skills. They're very important in supporting someone. There are 2 types of psychotic meds. That is what we call the typical antipsychotic medication, which reduce the positive symptoms, and we have the atypical antipsychotic medication, which treat positive symptoms, less likely to produce side effects or affect the negative symptoms or cognitive impairment. Well, there's so much to swallow with this diagnosis. All you have to remember, in order to diagnose this disorder, you need to have 2 or more, and one of the symptoms must be delusion, hallucination, or disorganized speech. And the disorder must last at least 6 months. And there's different type of medications, such as typical and atypical medication, to help you deal with this disorder. And most of all, psychotherapy is very important, like we mentioned. For instance, CBT and teaching social skills and training, as well as psychoeducation, teaching them about the disorder. That's very important for anyone who's going through this condition, or any family member who has someone going or diagnosed with this condition. And please, if you like this video, give it a thumbs up, share and subscribe for more videos. Please comment down below if you have any question or feedback. And if you know someone who's going through this, don't forget to refer them to this video. And as always, thank you for watching, and I'll see you in the next video.